How do we transfer a patient from one unit to another in the same hospital? My name is Priscilla Oyamati, and this is Raising Health with Priscilla O. And today we are talking about the checklist for patient transfer within a hospital. I believe the nursing care journey is important at every single stage. And one of such stages is the transfer of patients from one unit to another. We've all done it before, but how do we do it well? That's what we're going to talk about. So stay with me. If you haven't subscribed to this channel yet, please do. And you can also like this video and send in your comments after. Let's move on. Why is this checklist even important? One, it's important because it ensures continuity of care. Two, it avoids unnecessary repetitive procedures. If a drug has already been given and it hasn't been documented or it hasn't been communicated to the receiving nurse, it could be given again, and this could cause harm. If something has been done, or if an x-ray or anything has been done and then there is miscommunication or lost information, these things can be done again, and it might cause harm to the patient or unnecessary pain that the patient doesn't need. It helps to promote better care by the receiving nurse and also improve patient health outcomes. First on the checklist is to document the decision to transfer time and date. So whenever the doctors or whoever is in charge of seeing the patient decides to transfer the patient to another unit, document it. Write the date, write the time in your notes. It's very important, and this is why. Between the time a patient's decision has been made to transfer and the time that they are transferred, lots of things can happen. But if the decision hasn't been, the documentation hasn't been done for that period, and after the decision has been made, everything else that is done for the patient to the time that they are transferred, if that documentation is not done well, if something happens, the nurses are found wanting. I have seen it happen so many times at the accident and emergency unit, in the wards. It happens. When there's a decision to transfer a patient, write it down and then act on it. But if for reason there is a delay in it, make sure to document the delay and whatever is causing it, so that in case anything happens, you are covered. Always find out from the requested unit if there are available beds before you send your patient. It is very important. I have witnessed patients being sent to the unit or to the wards and they being brought back because there were no beds. It is frustrating to the patients. It makes them feel rejected, and some of them even end up feeling depressed because they feel there is something wrong with them. And then the people that actually send the patients also do get tired for nothing. So always make sure you find out from the units, call them, and make sure there is an available bed before you send your patients. It's very important. Don't just send patients without informing them. Make sure to gather all patient relevant documentations. Every lab results, every x-ray, film, anything at all that the patient has with their name on it that needs to be with them, gather them all. Their files, their notes, anything that has to go with them, anything that is in connection with their care, make sure you put them together whilst you are arranging for their transfer. Because patients do go to the wards and then they later find out, oh, my x-ray film is not here. And they come looking for it in their previous ward and it's nowhere to be found. Something gets missing, their notes, their things get missing during this process. So please make sure you gather everything that they need before they are taken to the unit. Don't wait for the very time that they are going before you put their things together. That's when things get missing. Start gathering them the moment you find out that there is an available bed. Start putting your patient's things together so you get them in one piece and nothing gets missing. What need does your patient have? Every need should be communicated to the receiving unit, to the nurse who is going to take care of the patient. Does your patient need blood? Was a vein tried and you were not successful? Does the patient need a new IV line? Does the patient need an interpreter? Is there a language barrier? Does the patient need help with mobility? Every need that you know your patient has should be communicated to the receiving nurse. And this should be done in person or via a phone. So you can pick up a phone and call them and give them that information concerning the needs that your patient has, or you can go over to the unit and deliver that yourself. But whatever be the case, this information needs to be communicated to the nurse because it is important in their continuity of care. Your patient, you have that responsibility to your patient to tell the one who is going to take care of them what they need and what they are lacking. Always choose an appropriate escort for your patient transfers. People who are not trained enough to know what to do if your patient's condition changes shouldn't send unstable patients, patients who are on oxygen, patients who are unconscious or semi-conscious, patients who need constant monitoring, or they don't need porters to send them to the units. What you need are qualified, trained nurses who would know what to do if your patient's condition changes. Porters can send patients who are conscious, patients who are stable. Those patients rarely have a change of condition whilst they are being sent to another unit. I have seen patients die along the way when they are being transferred, and the porters or the people sending them didn't even know, and they didn't even know what to do. So please, it's not fair to our patients, and it's a huge act of negligence on our part if we do that. So please avoid it and always choose an appropriate escort to transfer your patients. Go through your notes again and again before you transfer your patient. Everything that needs to be written, everything that needs to be penned down or typed in has to be done before you send your patient. You are sending your patient to another unit for another person to take over. So everything that you need to write, every assessment that you have done, every procedure, every medication, everything that you have done for your patient should be done and should be written. And you should make sure that it is there before you send your patient. So go over your notes and dot your I's and cross your T's before you send your patient. Put together all your patient's belongings. You are sending your patient from your unit. He's not coming back, he or she's not coming back. So everything the patient brought to the unit should be taken along with them to where they are going. So everything that they brought, whatever that their dress, their clothes, their jewelry, if they were taken off, or anything at all that belongs to them should go with them. Their medications they came with, everything, put them together. Sometimes you just have to label them. If your patients are unconscious, you label them with their names on, their full name on, and then you give it to whoever is sending the patient to take to the ward. So gather all your patient's belongings. Don't leave anything behind. You do not want your patient's relatives coming back to tell you they left their gold watch when it might not be so. So always make sure you put them together, all their belongings, and send them along so they don't forget anything. How are you transferring your patient? The right equipment to transfer your patient in is also very important. Is your patient going on a stretcher or on a bed or in a wheelchair? It all depends on the kind of patient you have and the condition or the state that they are in currently. So assess your patient and know if your patient is mobile, if your patient is fully conscious and very stable that they can sit down, you put them in a wheelchair. But if your patient can't sit or is not stable enough to sit, don't force them in a wheelchair. And then when they are going, they are almost falling. Put them on a bed or on a stretcher and send them to the unit. So always use the appropriate equipment in transferring your patient. Think about your patient's comfort and think about the dangers of them falling, which is also very, very, very serious. So always assess your patient and then choose the right equipment to transfer them in. What do you think about the checklist? Is it something that you think you can do or you can use in your hospital? Let me know what you think. Send me a comment. Give me a like. Share with your friends, your colleagues, and let's all help make patients care better. And let's ensure proper continuity of care. Be a great nurse. Be the nurse that you would like to take care of you, and let's all join hands in raising the health of the people that we take care of. Thank you.